Hello, Dr. Sullivan. It's Haley.
Yeah, hey, Haley.
Hi. I guess my question is, at what point would a decision be made? Could this be made a week before school, or could it happen as school has already started and students are already in classrooms and may not have the resources to do school online?
Yeah, so Haley's question is about when would this decision be made? And, even asking could this be made after schools were to start? That's not ideal. What we'd like to do is to, as I said, if this decision remains ours, is to make that decision before schools were to schedule start. What we don't want to do is start school and have to stop it because numbers are out of control. That's obviously what everybody's trying to avoid. But we have to remember that when we have 80,000 18 to 25-year-olds in this community, we can just only expect that our numbers are going to increase. What we really need to know is, are those numbers meaningful? Are those numbers going to impact our hospital utilization? Are those going to impact severe cases of COVID-19? We know that most 18 to 25-year-olds do very well with this disease as well. And so what's important to know is, how does it really impact our community? How does it really impact our hospitals? And that's the data that we need, and that's the data that we continue to work with. And that's what's going to be the platform of the evidence moving forward. And so we want that decision made before schools were scheduled to be opened or available, I should say, to face-to-face or in-person contact. And so, as I understand it, I believe we have a August 13th date for College Station tentatively right now. And so it would definitely be made before that, again, if this remains my decision. And but we will be diligent and remain to collaborate that, and a lot of work that we've already done and will continue to do to make this nuanced decision appropriate. Thank you, Haley. And on to the Eagle.
Hey, Dr. Sullivan, this is Kenny Wiley.
Yeah, hey, Kenny.
Hey, thanks so much. So I've got a question for Dr. Whitbeck and Mr. Martindale, and one also for you, Dr. Sullivan. So for Dr. Whitbeck and Mr. Martindale, if the situation requires at any point during the school year, is it your understanding about the whether it'll be up to the health district or each local school district in Brazos County to close schools and move all students to remote learning? And I'd be interested to hear your perspective on that too, Dr. Sullivan. And also for Dr. Whitbeck and Mr. Martindale, talk to us, if you could, about your conversations with teachers and principals in your respective school districts about their concerns about safety, and just kind of help us understand the perspectives that y'all have been hearing to this point.
Okay. Do we both able to hear the question? Okay. Very good, Kenny. And I'll address my part, and then I'll leave the podium for the two superintendents. But what I'll say is that a lot of collaboration that we've been having, a lot of meetings that will continue. I have a tremendous amount of respect for both these superintendents, for their concern, for their care, for all that they're considering, as you mentioned, with teacher safety, with the student safety, and it's been an impressive task. And we have two excellent leaders who are up to that task. What I'll say, though, Kenny, is from with respect to the health side of this, and we have to remember that we kind of got to stay in our lanes, but then we got to communicate and stay in our lane from the health. And just today, the CDC put out its guidance with respect to schools. And I've had a chance to review it. I haven't had a chance to review it in the detail I'd like yet. As I said, it just came out today. But it's clear that when you look through that guidance, underpinning that is what is going on in the community. It is clear that the community effect needs to inform the school decision, and that makes sense. And as a matter of fact, it outlines different levels of community impact. And it goes through to include a sustained transmission that is uncontrolled. And we're not there. We do not have an uncontrolled situation. And we have sustained transmission in our community. Is it mild? Is it moderate? You can get into these terms, and I'd like to see how they're defining that. But we have transmission. We're reporting our cases today, and we've been reporting our cases, but it's certainly not out of control. Our hospitals have been able to maintain, and they've been able to actually even maintain with their elective procedures, and we're making it. The big wild card, as I mentioned in my talking points, is that we have students coming in. We don't know that effect yet. So there's going to remain the collaboration in that respect from our areas, and I've been grateful to them for that collaboration thus far. And so I'll open up to whoever, Dr. Whitbeck, is going to come up first and speak to the second part of your question, Kenny.
Hi, good afternoon. In regards to the first part of the question, all districts are able to shut school down only if it is authorized by the local health authority. And that was a new guideline that came about just last week. So we do very much depend upon these conversations with Dr. Sullivan and others because we know that should we start and then have to stop again, that will be at their discretion. We do know, though, that we must provide virtual and face-to-face instruction. To the second question, I know that we would say probably our number one focus right now is our teachers, because in order to take care of the kids, you have to have your teachers there, they have to feel safe, and they have to feel as though the protocols are in place for them as well. So I know I have a teacher task force. We both have surveys asking them their preferences, and we're looking at all of that, looking at schedule modifications to allow teachers more time, and we're also even considering a calendar adjustment, perhaps in the near future, to give us a little bit more time as well for teacher preparation. So those are some of the things, but teachers are right now really number one on our mind and in our hearts in order to how to go forward.
I would echo much of what Dr. Whitbeck said. I think one thing that as we collaborate and what we're looking for are thresholds that we collectively create to help us determine at what point would school closure be necessary. So those are items, or that information is something we will work with Dr. Sullivan in establishing. And in essence, hopefully that could be applied throughout the county with all school districts. As far as our teachers, our students, our faculty and staff, safety for everybody is the primary function. And as we establish our district level protocol and apply that to the campus level, as the campuses develop that, obviously they're getting feedback and direction from those people on campus, feedback from principals, from teachers. That is why we're requiring masks throughout. We are trying to put things in to mitigate the spread and help us manage this as we safely plan to reopen. We are currently penciled in to offer on-site and virtual as of Thursday, August the 19th. That's what we have down at this moment in time. However, I think we all realize, considering our circumstances, that one thing that is constant is change. So we will plan and focus forward and understand that might change on us fairly quickly. But the safety of all, the planning, the conversation, putting protocol in place, it is what we're focusing on at this point in time. And looking forward to establishing those thresholds for when schools would need to close due to infection rates or whatever markers that Dr. Sullivan and the health department would recommend to us.